Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today is Dr. William Harris. He obtained his PhD in human nutrition from the University of Minnesota and did postdoctoral fellowships in clinical nutrition and lipid metabolism at the Oregon Health Sciences University. And he's here in studio today with us as president and CEO of Omegacoin to discuss new research with RBC fatty acids and the development of type 2 diabetes. Welcome to the program, Dr. Harris.
Thank you very much.
Thank you. Now, you are the president and CEO of Omegacoin. Talk a bit about Omegacoin. What exactly is Omegacoin involved in?
Omegacoin is an analytical laboratory, and we are located in Sioux Falls, South Dakota, about as far away from water as you can get, I think, in North America. But our interest is in omega-3 fatty acids, and we measure them and other fatty acids in blood samples that are sent to us from researchers, from doctors, and patient care, and even consumers can send dried blood spots in for analysis. So that's what our primary business is.
Have you found yourself consulting or being consulted by or with pharmaceutical companies in your testing?
Yeah, we have currently are working with pharmaceutical companies that are testing the effects of omega-3 based pharmaceutical products, either in humans for heart disease or for other humans who've got like cystic fibrosis, looking for omega-3 connections there, etc.
How often are you tasked with running a study or conducting tests to, I guess, confirm or disqualify something that someone else has already done? Say a pharmaceutical company has done their testing, but they'd like to do another test from an independent source. Is that something that you're involved in as well? Yeah,
we would do a confirmatory study, is what we would call it. Okay. And that's been a part of our work over the years as well.
Now, there is some new research surrounding RBC fatty acids. Talk about that research. Is that something that you're heavily involved in?
Yeah, a lot of our work is related to red blood cell, RBC, fatty acid levels. We like the red blood cell as a sample type when we analyze. It's very much like when you measure glucose status in a diabetic, you want to measure their hemoglobin A1C, which is a red blood cell based test because you're measuring hemoglobin, of course, as opposed to plasma glucose, which is much more noisy, moves up and down a lot. The same is true with omega-3. It really is much more stable when measured in red blood cells. So if you want to get an overall look at a person's normal omega-3 status, that's the best place to look, is in red blood cells. And so we've conducted a variety of studies, both in heart disease and diabetes, and now we're looking at dementia and total mortality, death from any cause, all as they relate to red blood cell fatty acid patterns. And so we're continuing to publish in that area.
We're talking about omega-3s. We hear about it being especially good for heart health, but you did talk about type 2 diabetes as well. Talk about the development of type 2 diabetes and how it relates to these omega-3s.
Well, actually, interestingly, most people, ourselves included, don't really find much of a link between omega-3 levels and development of diabetes. There are other fatty acids in the blood that are pretty strong predictors of future risk for diabetes, and these would include some of the saturated fatty acids like palmitic acid, which is a 16-carbon fatty acid, palmitoleic, which is 16 with one double bond. Those fatty acids, higher levels of those in the blood do predict increased risk for diabetes. So red cells fatty acids have a lot of information in their patterns, for some diseases and not for other diseases. And so we're just beginning to sort all that out.
What about samples taken from children or infants? Are there huge differences or different types of criteria when it comes to testing RBC fatty acids in those that aren't adults?
Well, kids have lower levels of omega-3. We don't really, because so little research has been done in kids on the question of omega-3, we really don't know a lot about it. There certainly have been some links to higher omega-3 associated with better ability to read, less risk for ADHD, some other neuropsychiatric conditions that are seem to be at less risk for if you have higher omega-3. Certainly omega-3 fatty acids are important in brain development in babies because one of the omega-3s, called DHA, is a major component of the brain, and it's found in breast milk, in normal breast milk. And so we actually have not a blood test, we have a milk test, a dried milk spot that women can send in, and we can measure how much omega-3 is in their milk and make some recommendations for them. But the omega-3s play a role really from cradle to grave, because we're also looking at omega-3s as predictors of dementia and Alzheimer's disease.
Do you find that there are different types of fish that are better as a source for omega-3s?
Oh, sure, there are. The consumer really you can't tell how much omega-3 is in a fish, but you can kind of tell if it's an oily fish or not, as opposed to a dry fish. The oilier the fish, the more omega-3 is going to be there as a rule. And it's the most common fish that have high omega-3 would be salmon, albacore tuna, or white tuna, it's called sometimes. Then you get into mackerel, herring, sardines, anchovies. These are all actually oysters are pretty good with omega-3 too, surprisingly. But you get down to tilapia and cod, and there's quite a bit less omega-3 per serving in those kinds of fish. But I would still advise people to eat even that compared to eating something that has no omega-3 at all, steaks or hot dogs or hamburgers, things like that. Seafood's always better.
You said that there's no way that you can measure the omega-3 in a fish. What about measuring the omega-3 in a person? I mean, there are different indexes, body weight mass index, things of that nature. Is there something in place that can measure omega-3s in people?
Yeah, we've developed over the last 10 years a metric that we call the omega-3 index. And it is measured in blood, and it reflects how much EPA and DHA, the two omega-3s that are in fish, the two important omega-3s, how much EPA and DHA are in red blood cells in their membranes. And it goes from roughly 2% on the low end to 12-15% on the high end, and it's a percent of the fatty acids in the membrane. The average American's around 5%. EPA and DHA in red cells. The average Japanese is around 10%. We think levels of around 8% and above are the really a protective zone you want to be in.
Can we find ourselves in that protective zone by diet alone, or are supplements the norm? And if they are the norm, are they the norm just in the United States and other Western nations, or are we talking about the same thing happening in countries like Japan that you mentioned?
You don't have to use supplements to get levels up in that target zone, to be sure. I mean, the Japanese are a classic example where if you don't mind eating fish for breakfast, lunch, and dinner, then you're going to have a high omega-3 index. But most Americans, that's not our culture. We don't have that kind, and we don't have the oily fish, easy access to it that they have. So most Westerners, will say, whose diets are very low in omega-3 to begin with, supplements is a reasonable way to go to raise the omega-3 index.
Now, in your opinion, what is the recommended intake to get the best benefits from fish or the fish oil?
I think there's some consensus that says around 500 milligrams a day of EPA and DHA. So those two, a standard fish oil pill, the cheapest classic fish oil pill, will have about 300 milligrams of EPA and DHA. We think 500 is probably a good target. A serving of salmon, a regular-sized serving of salmon, would have about 1,000 to 1,500 milligrams of omega-3. So 500 milligrams a day is doable. The average American intake is in the neighborhood of 100 milligrams a day now.
Very small.
So we recommend basically going up by right. If you're pregnant, lactating, anything higher, 700 maybe to 1,000 milligrams. And if you've got want to reduce risk for, if you've already got heart disease, you want to reduce risk for future cardiac events. We think around a gram or so or more is probably helpful.
Now, let our listeners know where they can go to get more information about Omegaquant.
They can go to our website. It's called Omegaquant.com, O-M-E-G-A, and then Quant, Q-U-A-N-T.com. And there's a lot of information about testing, and people can order a dried blood spot test on themselves to get their own omega-3 index if they want to.
Great. It's been a pleasure having you here with us in studio today, Dr. Harris.
Enjoyed it. Thank you very much, Neal.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today with Dr. Bill Harris, founder, president, and CEO of Omegaquant, discussing some brand new research with RBC fatty acids and the development of type 2 diabetes. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.